My name is Asnia,
I'm Mikhail.
and we have two other team members, Linette.
And Vedant. Our team name is Team Revamp, and we're aiming to revamp the POTS space, specifically the diagnosis and treatment of POTS in Ontario.
And you're probably wondering what POTS is, which is postural orthostatic tachycardia syndrome. Yes, it's a mouthful. It is a condition that is a lot more prevalent than we really know because it is underdiagnosed, so prevalence studies don't do justice to the number that's there right now.
As of now, it takes 6 to 12 years to get treatment, and basically we want to shorten that. We want to see why physicians aren't treating it.
What the gaps are. POTS is a lot more prevalent than we know, and the prevalence has doubled since COVID-19. There are a lot of long COVID patients that are actually presenting with POTS now. Why it's important is because these patients get misdiagnosed and dismissed a lot, and they have very long wait time to be diagnosed and then to get care, which can be by like 5 to 7 physicians or 6 to 12 years of a diagnostic lab.
And that leads to a lot of frustration, justly, and also a lot of prolonged suffering, which shouldn't be the case.
Poor quality of life, disabilities, difficulty going back to work. And so this is why we're interested. We want to make the space just a little bit better for the patients.
We want to work with physicians to see what feasible barriers there are that we can address together and increase not only diagnosis but also treatment of POTS patients.
As is true to the translational process, we want to, however, make a difference to the patients in the context of the physicians and the other stakeholders that are involved. And so it's not that we can just tell somebody to do something different. We also have to resolve whatever their barriers are. And that's why we're targeting physicians. And we're hoping that just by doing the project, we also create more awareness of the subject.